Hello, my name is Ghaitsa Nurjannah, medical student from Universitas Airlangga. This video captures my 4 weeks elective experience at Hospital Universiti Kebangsaan Malaysia. In my first 2 weeks, I was placed in the emergency department. I spent a lot of time doing clinical observation. I followed the team during primary and secondary assessments as well as in the green, yellow, and resuscitation zones. I learned how they manage different acute cases, from assessing the patient, doing investigations, stabilizing their condition, and preparing them for referral to the other departments. We also had the chance to practice a few basic procedures under supervision. We got to apply ECG leads, give intramuscular injection, insert IV lines, and even help with CPR in the resuscitation zone. Besides observing, we also attended several teaching sessions. We joined ECG class session with Dr. Faisal, focusing on myocardial ischemia and acute myocardial infarction.
Sinilah checkpoint. So elevated tu mungkin dalam satu kotak setengah kecil tu. Ni pun elevated satu kotak setengah kecil.
We also attended a pre-hospital care class with the paramedics. They showed us how emergency calls are received, what they do at the scene, how they manage patients inside the ambulance, and how they hand over patient at the hospital. On top of that, we learned about interfacility transfer and the proper steps to handle needle stick and sharp injuries. After finishing 2 weeks in emergency department, I moved to the plastic and reconstructive surgery department for the second half of my elective. Every morning, we started with ward rounds. We met in the burn unit first, then continued to the other wards. The doctors usually check pre-operation and post-operation patients, perform debridement, clean wounds, and change dressings. Sometimes we were allowed to help, and it gave me a lot of practical insight. The department had a routine weekly schedule, except an emergency case came in. Clinic on Monday, Tuesday, and Friday, minor OT on Wednesday, and major OT on Thursday. In the wards, we saw a mix of cases like burns, pressure ulcers, trauma, and infections. In the clinic, most of the patients came for scar, suturing, surgery removal, and keloid injection. We also got to assist with keloid injection and burn scar dressing, which was a nice hands-on experience. I observed many surgeries during this rotation, including nevus excision, xanthelasma excision, abscess drainage, hematomas, dog ear scar revisions, and skin grafting procedures. The most memorable case for me was a wide local excision for a buccal tumor with an ALT-free flap. It was a long surgery done together with the ENT team. The ENT surgeon was actually an adjunct professor from our university, Professor Dr. Morazif Muhammad Yunus. He was very warm and open to us. He even shared stories about his colleagues and his experiences in Universitas Airlangga. My supervisor, Dr. Azim, also brought us to a private clinic to observe cosmetic procedures such as rhinoplasty, breast implants, and deep facelift. It added something special to my rotation. Besides gaining many new experiences in the hospital, I also built new connections. I met my supervisor from the emergency department, Dr. Evelyn. I also met Prof. Khaldun. He is very kind. He even invited us to come to his house. Every Wednesday, we visit him and he always prepares coffee and tea for us. We really enjoy meeting and having conversations with our new friends. And on one occasion, he even cooked meals for us. It was such a warm and memorable experience. I also met Dr. Azim, my supervisor in plastic surgery. He was very enthusiastic about bringing us to see various types of surgeries, from reconstructive procedures to cosmetic ones. I also met the residents from both departments. They were all very kind and welcoming. They taught us so much, from theories to clinical applications. And that wraps up my 4 weeks elective experience. It was a short rotation, but it gave me lessons and experiences that will stay with me throughout my learning journey. And I'm truly grateful to everyone who guided us along the way. Thank you for watching.